Hi guys. So today we're going to get on the topic of another side symptom of dissociative identity disorder. Last week I touched basis on fibromyalgia. This week I'm going to touch basis on CFS. What is CFS? CFS is chronic fatigue syndrome. It is very similar to fibromyalgia, and I want to get into the details about it, the research behind it, and the links to help you out. So here we go. So this first article I'm going to read from is called verywellhealth.com, and it talks about the difference between fibromyalgia and CFS, which is chronic fatigue syndrome. It states here they're both chronic conditions that have similar symptoms. Both cause extreme tiredness, which could cause ME/CSF to be misdiagnosed as fibromyalgia. However, fibromyalgia usually causes more chronic widespread pain, while in ME/CSF, the distinguishing symptom is extreme fatigue that doesn't go away, even with rest, severely limiting the ability to do daily tasks. Exercise or physical activity often makes symptoms worse in both conditions. So healthcare providers look carefully at the type and pattern of symptoms to figure out which one a person might have. So CFS is also known as myalgic encephalomyelitis. I hope I said that right. It's a big word. The term CFS focuses on fatigue as the main symptom, but has been criticized for oversimplifying the condition, adding ME. Highlights possible issues with the brain and immune system. Same as fibro, kinda, but less. Like inflammation and muscle pain. Using both terms together helps show the full picture of the disease. And next is a video talking about ME/CFS, and I want you to listen to it and see what it's about, and they give helpful tips and about the symptoms, whatnot. I don't own rights to this video. It's available on YouTube. I'm just giving you the short version of it, and I would suggest looking more into it if you feel that this is something that may be related to you and you have DID. It is good to definitely get an idea of what you're dealing with and how to manage it. So here's the video.
ME/CFS is myalgic encephalomyelitis, commonly called chronic fatigue syndrome. It's a life-altering, debilitating disease, similar to fibromyalgia, chronic Lyme, and other chronic complex diseases. There are no FDA-approved treatments, there is no cure, and there is no diagnostic test yet. ME/CFS is a multi-system disease affecting the brain, the immune system, and energy metabolism. Symptoms can appear suddenly or have a gradual onset and include a profound lack of energy that is not relieved by rest. Post-exertion malaise, the hallmark of ME/CFS, is a worsening of symptoms following any type of exertion. Other symptoms can include unrefreshing sleep, cognitive impairment, dizziness, severe headaches, pain, sore throat, sound and light sensitivity, and many more symptoms. ME/CFS is a global health crisis and can affect anyone at any time. Estimates state up to 2.5 million Americans and way over 20 million people worldwide are affected when you look at all of the similar chronic complex diseases. And about 90% of people aren't even diagnosed yet. The mission of Open Medicine Foundation is to fund and facilitate open and collaborative medical research, to develop a diagnostic test, potential treatments, find a cure, and ultimately prevent ME/CFS and other similar chronic complex diseases. Through our worldwide tour and research news updates translated in multiple languages, we deliver hope in over 100 countries to millions of patients who are leading very limited lives. Many are homebound, unable to work, and unable to go to school. Please join our OMF team and donate today at our website, www.omf.ngo, and help us in our mission of leading research and delivering hope.
So what about the nano needle thing, right? So basically this is an article through Stanford Medicine, which shows here. And you can read the whole article if you understand all this scientific stuff through med.stanford.edu. Now, I'm going to just read the basics on this. It says the nano needle biosensor is a cost-effective, versatile, ultra-sensitive, and high-throughput nanoelectronics device. This device measures the electrical impedance of cells from a single drop of blood. The test is able to distinguish ME/CFS patients with healthy controls. It states here, what is the new blood test for CFS? The new blood test developed at Stanford, called the nanoneedle assay, may help diagnose ME/CFS by measuring how immune cells respond to stress. In a small study, the test successfully identified all the people with ME/CFS. It is still being studied and tested, so it is not yet available for a diagnosis. And on this side, you can see the chart and the imbalance on the chart of normality, and then how the ME/CFS jumps. It doesn't vary. My own personal experience with this, when my blood work was tested, which is still tested every time I go in for a doctor's appointment, it seems like my white blood cell count is always off, which means there's a problem with like autoimmunity deficiency issues. Basically, I'm fighting an infection that isn't there. It's kind of how it puts. My father, who also had kind of a similar disorder, or disease, sorry, he had PMR, which is another big word. And the issues being exposed to Agent Orange also caused a lot of issues. So next, let's get into the differences, shall we? Chronic fatigue syndrome and fibromyalgia have many similarities, but each one has distinguishing features that help tell them apart. The key differences can be summarized as follows. So let's take a look at this chart here. So as you can see, fibro's featured and chronic fatigue syndrome. Okay. The first one says primary symptom. Fibromyalgia is widespread pain and tenderness. Okay. Chronic fatigue syndrome, persistent, unexplained fatigue that doesn't improve with rest. Okay. Very similar. Additional symptoms may include fatigue, sleep disturbances, brain fog, headaches, sensitivity to light and sound. Okay. Chronic fatigue syndrome may include post-external malaise, orthostatic hypotension, unrefreshing sleep, brain fog, joint pain, sore throat, swollen lymph nodes. So you're going to feel it more here, okay, than you are all over, okay? I think that's what they're getting at. Okay, now the diagnostic criteria. Based on the presence of general pain in at least 4 out of 5 specific body regions and widespread pain in at least 7 out of 11 body regions, with symptoms lasting at least 3 months. So that's what I was tested for, and that's why I was diagnosed with fibromyalgia. I scored 18 out of 20, whatever that means. Now for CFS. Diagnostic after 6 months of unexplained fatigue, accompanied by at least 4 other specific symptoms. So if you notice, they're very, very similar. That's why the tests are so vital. Root causes. For fibromyalgia, it states exact causes unknown. Potential factors include genetics, infections, and physical or emotional trauma. Okay. CFS says exact causes unknown. Possible triggers include viral infections, immune dysfunction, widespread inflammation, and hormone imbalances. A little bit different there, huh? Last is the treatment. Focuses on managing symptoms through medications, physical therapy, and lifestyle changes. CFS states focuses on managing symptoms through medications, cognitive behavioral therapy, exercise therapy, and techniques to manage energy. So again, slight bit different. But I also get CBT, which is cognitive behavioral therapy, because of the trauma and the somatic symptoms. Somatic symptoms are symptoms that are in the body that they can't find no known cause, but you feel it. So per se, when I'm processing trauma severely, I will feel pain between my legs, or I will feel pain in my body of whatever is happening in that memory that I'm processing. Hope that makes sense. So next, let's get into how DID and CFS ME kind of go together. Okay. So if you look up the basic Google search of this, you will see that CFS and psychopathology link together. And it states studies have shown that individuals with CFS report higher levels of childhood trauma and psychopathological symptoms compared to the control groups, indicating a potential connection between these factors. Specifically, a study published in JAMA GAMA found that exposure to childhood trauma associated with a 6-fold increased risk of CFS. Okay. Some research suggests that a variety of personality disorders, including obsessive compulsive, heterostronic, and dependent, may be more prevalent in individuals with CFS. However, it is important to note that studies have yielded inconsistent results regarding the prevalence of personality disorders in CFS patients, with some studies finding lower rates than previously reported. So it's an iffy back and forth on, does CFS go with DID, does it not? So it states here, while not directly linked to CFS, researchers suggest that individuals with CFS may experience dissociative symptoms like loss of identity, disorientation, and emotional liability, which are also seen in DID. So in this, as you can see, I'm looking at these, and this is just, like I said, the Google part of it, and it states potential overlap and considerations. While there's no definitive link between CFS and DID, the overlapping factors of childhood trauma and potential dissociative symptoms suggest that these conditions may coexist or share common pathways. And these are things that are being looked into because people don't talk about this, okay? It's crucial for healthcare professionals to be aware of the potential for comorbid psychiatric conditions in individuals with CFS, including dissociative identity disorder. Further research is needed to fully understand the relationships between CFS, DID, and other psychiatric disorders. Now, last on this part of it, I want to talk a little bit about PMC PubMed Central, which is National Library of Medicine. They actually show a study on it, and you'll see this little article here. It's called Personality Features and Personality Disorders and Chronic Fatigue Syndrome, a population-based study. So they did this study. I'm not going to read the whole thing because it'd take forever, but the conclusion is what I'm after. And it states, our results suggest that CFS is associated with an increased prevalence of maladaptive personality features and personality disorders. This might be associated with being non-compliant with treatment suggestions, displaying unhealthy behavior strategies, and lacking a stable social environment. Since maladaptive personality is not specific to CFS, it might be associated with illness per se rather than with the specific condition. So they're basically getting into the percentages, the studies to see what exactly coexists, okay? I'm not saying it is an if or if not, but it's something to have looked into. So basically, why am I doing all this studying on this? Well, the truth is, and it's a hard thing to bite down on, is that with dissociative identity disorder, the brain is doing all this stuff, okay? And my opinion on this, again, I'm not a professional, but based on my experiences and what I've been through in the last 20 years, I'm going to explain something and simplify it in terms you can understand other than the scientific terms, okay? And that is, with dissociative identity disorder, somatic symptoms are very real, to the point where if you have those somatic symptoms over, let's say, a 20-year basis, let's base it on my own issues. When you are in a hypertension mode and you are switching, your heart rate, body temperature, and everything else is changing as well. And what happens is that these somatic symptoms over, let's say, 20 years of having these somatic symptoms, these alternative states of mind, the switching, all that causes body ailments. And because even though they're not sometimes real symptoms, they're based on memories and body sensations, they can put that body in overdrive. It's kind of like when a lion attacks, let's say, a gazelle, okay? That gazelle is going to go to faint, or flight, fright, or faint, okay? Or freeze. Sorry, my mind's having a freeze moment. And what happens is they're doing that to either be eaten because they don't want to feel it. Their brain goes, numbs it out, okay? Or they're going to numb and then all of a sudden say the lion gets distracted, walks off. That thing has got a choice to either run or stay frozen and be eaten. Sometimes they'll run. But With animals, it's a tad bit different because I think the memory doesn't stick as long. They got more of a short term. Some animals, it doesn't. Per se, dogs, cats are abused severely. They remember. They'll continue to remember, which is why some dogs will bite, because they have been abused traumatically. So, these are studies that are trying to be understood, especially with the human mind, because we are more advanced, okay? Monkeys can remember a human face for years. And so, you can put them out in the wild after they're grown and they can remember that person for many years. They have a good memory. Somatic symptoms are very similar because, let's say you're traumatized severely. Those memories are embedded in there. And if you don't process through them, some people say it's triggering. I don't want to process through it. If you don't face them triggers, you're never going to heal. It's the same with the somatic symptoms. You can ease those symptoms with the work. If you get through those memories, process through them, even though you're feeling them in your body, you're feeling those emotions, it's very scary, almost feels like death at times when you got to go through them memories. If you get through them and you process over and over and over and over to the point where it's like, that's not so scary. And then all of a sudden the symptoms start to ease a little bit. Now, the problem is, as you get older, your body will still have issues. Because of me going through this for so many years, my body has fibromyalgia, the start of degenerative disease, PCOS, DIBS. I have a lot of issues, thyroid issues. I have white blood cell counts that are off. These are things that I have to deal with. I refuse to sit down, though. I refuse to quit. I refuse to, give in. I will continue to walk till the day they tell me I have to have an aid. I will continue to paint, work, do things that I want to do because I refuse to let it take me over, So anyway, that is a little bit of knowledge on this whole subject. I hope you found this article and the research behind it interesting. I know I did. And let me know if you have CFS and you have a dissociative identity disorder. I'd love to see more articles about it. I'd love to know, if there's more of a touch and go with the two. I know there is with fibromyalgia. I just found it interesting that this also was brought into my awareness. So that's all I have today. Loves. Bye.